All right, this is Pat Walsh with Walsh Wellness Center. The first thing we're going to discuss today is ankylosing spondylitis. Ankylosing spondylitis is a disease process of the spine. It usually hits males more than females. Usually under 40 it begins. And really what happens in this process is the fact that the vertebrae start to fuse together. And it's mostly, not mostly, but it usually or typically is more up higher in the spine, like in the thoracic spine. But it'll appear anywhere. As you can see in the illustrations, that the vertebrae starts to fuse in the joints, the posterior joints start to fuse, which means you're going to lose motion in that. So, what can you do? That's a good question. There is at this time no preventing or even stopping. What you can do, treatment is of course get adjusted. Keep movement in the segments as much as you can. So through some different therapies and exercises and stretches given, that's what you can do. Typically what I like to do is try to get as much motion in there as possible without pain. With something like this, typically it's more in the thoracic spine first, at least. So what I like to do is use a foam roller and have the patient lay on the back and have the foam roller act as a fulcrum in the thoracic spine, and you just use your arms as like a weight over the fulcrum to have the patient extend over the foam roller. It's kind of a rough one. It's not fast, but it's not slow either, the process. So the quicker that we can get a correct diagnosis and therapy started and adjustments, things, and changing that lifestyle, the better off for the patient. So that is ankylosing spondylitis.